We're going to let everybody know where things stand right now. Worldwide, the total number of cases has now topped 1 million, with the virus spreading to at least 181 countries. Here in the U.S., there are now more than 245,000 cases and nearly 6,000 Americans have died. Meantime, New York City has joined Los Angeles, advising residents to cover their faces whenever they go out in public. We expect the CDC to soon tell the same to Americans in hotspots for the virus. However, the president said it would not be mandatory. And the FDA has authorized the first blood test that identifies people who've had and already recovered from the coronavirus. It's seen as a potential step forward in the eventual development of a vaccine. Savannah.
So there are a lot of different moving strands this morning. We've got our team of correspondents covering all of it. Let us start with NBC's Sam Brock. Sam, good morning to you.
Savannah, good morning to you. Florida's statewide order to stay at home kicked in just 7 hours ago. I'm standing right now on Lincoln Road. This is typically one of the busiest places in all of South Beach. Right now, it's empty. Many states are ramping up their precautionary efforts this morning, but as new expected guidelines from the federal government, specifically as it pertains to face masks, that could mean big changes for millions of Americans.
A senior Trump administration official telling NBC News new guidance is coming soon, advising Americans who live in areas of high community transmission to wear cloth masks to prevent the spread of coronavirus.
Given the fact that we know that asymptomatic people are clearly transmitting infection, it just makes common sense that it's not a bad idea to do that.
That measure already taken by the mayors of New York and Los Angeles.
This will be the look.
Members of the LAPD are now wearing masks on patrol. President Trump also using the 1950s-era Defense Production Act to pressure manufacturer 3M to make more masks. Tweeting overnight, "We hit 3M hard today after seeing what they were doing with their masks. P-Act all the way." At Thursday's briefing, the White House suggesting
we've had some issues making sure that all of the production that 3M does around the world, enough of it is coming back here to the right places.
The Minneapolis-based company could not be reached for comment, but now will have to pump out millions more masks
to ensure that domestic manufacturers have the supplies they need.
It comes amid the debate over a nationwide stay-at-home order. Overnight on CNN, top health official Dr. Anthony Fauci getting more vocal about the need for a blanket policy.
I don't understand why that's not happening. If you look at what's going on in this country, I just don't understand why we're not doing that. We really should be.
In Tennessee, the governor relenting to calls for a stay-at-home order in that state, citing new evidence of increased activity.
It's dangerous, it's unacceptable, and it's a threat to lives in our community.
But in Oklahoma, only people 65 or older or those with compromised immune systems are being advised to stay inside. In states like South Carolina, Alabama, and Arkansas, there's still no stay-at-home mandate at all. In Florida, a stay-at-home order going into effect today, but only after Governor Ron DeSantis offered an exception for religious services.
I don't think the government has the authority to close a church. I'm certainly not going to do that.
And going back to new guidance on covering your face in public, nobody's talking about using the kind of masks, N95 masks, that first responders need. Instead, they are discussing homemade versions, scarves or bandanas, not the critical supplies, Hoda, that we know those on the front lines need right now. Back to you.
Absolutely, Sam. Thank you so much. Now to the deepening crisis right here in New York after yet another surge in COVID-19 cases and deaths. And once again, officials are making desperate pleas for more emergency equipment. NBC's Gabe Gutierrez is at Elmhurst Hospital in Queens. It's one of the busiest in the nation right now. Hey, Gabe, good morning.
Hoda, good morning. As you just heard, in an all-out effort to flatten the curve in this hard-hit city, the mayor is urging all New Yorkers to wear some sort of face covering because even people who don't show symptoms can spread the virus. Now, the governor is saying that the state could run out of ventilators within days. This morning, new guidance for New Yorkers. Cover your face when going outside.
It could be a scarf. It could be something you create yourself at home. It could be a bandana. It does not need to be a professional surgical mask.
That new recommendation comes as the city is in danger of running out of life-saving ventilators.
At the current burn rate, we have about
6 days of ventilators in our stockpile.
In the tri-state region, more than 3,000 people have died. New York City alone now accounts for about a quarter of all confirmed coronavirus cases in the U.S. This map shows poorer neighborhoods have been hit hardest. Daily calls to 911 have shot up 50% to ease the strain on overcrowded ERs. Paramedics are no longer taking cardiac patients to hospitals if they don't have a pulse.
Our resources are really stretched thin. Decisions have to be made to ensure that everybody gets the most amount of care possible.
Among the lives lost, James Valleco, a veteran and a mechanic for the FDNY.
He used to tell me, don't worry, you're always worrying. But he was my strength, and he was a calm and quiet spirit.
The governor says he doesn't understand why the military is only treating non-COVID patients aboard the USNS Comfort. The 1,000-bed hospital ship only has 19 patients so far, but help is on the way from across the country.
I will be the first one in my car to go wherever this nation needs help as soon as we get past this. I will never forget how people across this country came to the aid of New Yorkers when they needed it, and I deeply appreciate it.
Reinforcements like 32-year-old nurse Jessica Fink from New Mexico, who just started work at a New York ICU.
I have specifically pulmonary critical care experience, so, if anybody should be helping, it should definitely be me.
The change comes amid a powerful show of solidarity. Firefighters applauding doctors and nurses at the U.S. epicenter of the coronavirus crisis. And authorities are also facing a lack of critical hospital bed space. The Javits Center, the massive convention center in Manhattan, will now start taking coronavirus patients. Previously, it only took non-COVID patients, and authorities are also looking into whether to take patients to Manhattan hotels, which would help treat the sick. Savannah?
All right, Gabe Gutierrez in New York for us. Thank you. And we're joined now by NBC News contributor Dr. Joseph Fair. He studies viruses for a living, worked in Africa during the Ebola outbreak. Dr. Fair, good morning. I want to zero in on this issue about the masks. What is the data? What's the science behind this new requirement that we expect today from the CDC, not requirement, suggestion that Americans in hotspots wear some kind of facial covering?
This is really based on, 2 or 3 studies, both coming out of China, Iceland, and here in the U.S., that anywhere from 25 to 50% of infections would be what we call silent infections or asymptomatic. So the mask is not to protect yourself, because, we don't want people thinking it's going to keep you from getting infected, but it's to keep you, if you are asymptomatic and you're falling in that category of a silent infection, from transmitting it to others. So we know that that is a major cause for the explosion in cases that we're seeing here in the U.S. And so having a mask on physically keeps those droplets from coming out of your mouth and onto someone else. And I should emphasize, a mask does not mean that you shouldn't social distance, because if you're doing the proper social distancing, it's still not a problem. But we know not everybody's doing that. So if you wear the mask, that will physically keep others from getting the virus coming from, literally out of your mouth.
Yeah, might stop you from touching your face as well. But let's talk about what kind of mask. We can all agree, and it is worth saying, again, not those N95 professional grade masks that our healthcare professionals so badly need right now. Would any kind of face covering do? I mean, could you take a handkerchief and hold it over your face, or a bandana? I mean, if you're not handy with a sewing machine?
Absolutely. You can use anything that you can, get from your home. One of the more innovative ones that I saw was someone actually using a pair of underwear and, tying it around their head. But you can use handkerchiefs. You can use anything that you can tie around your face. It's not ideal to have something that wouldn't be on your face all the time, because, you're going to have to keep it up there a lot. And I should also emphasize, we're particularly emphasizing this in places like grocery stores, pharmacies, places where we have no choice to go, but where you are going to be in close proximity to others.
It's our understanding that the White House and the CDC are going to issue a guideline that it will apply to hotspots only, places where there is community spread, and that it won't be mandatory. Do you agree with that? Do you think it should not be mandatory?
No, I don't agree with it. To be honest, if we know that 25 to 50% of infections are silent or asymptomatic, I think just like a lockdown, there should be a nationwide mandate that we all start doing it. And again, we're getting this data after talking with China and other countries that had a lot more cases early on. And they showed that they demonstrated rather that a lot of their cases were, they were able to lower their numbers by people actually wearing masks and not transmitting the virus to others.
All right, Dr. Fair, thank you so much. And I know you're going to be back in a few minutes to tell us about some other alarming new research on how this virus can be spread. We're learning so much, Hoda, as it all unfolds before our very eyes. Back to you for the moment.
All right. Thank you, Savannah. Let's talk now about the mounting economic toll of this crisis and those record-shattering unemployment numbers. So what is being done to help struggling families who've lost their income, and will that money arrive on time? NBC's business correspondent Jolene Kent has that part of the story. Hey, Joe, good morning.
Hey, Hoda, good morning to you. A record 6.6 million people applied for unemployment benefits last week alone. And as bills are coming due and workers are hurting, Washington says help is on the way.
This money does people no good if it shows up in 4 months.
This morning, as U.S. unemployment numbers explode, time is running out for struggling Americans desperate for federal aid. Now, the White House is pushing back on reports that relief could take months, saying while paper checks may take longer, direct deposits will come earlier than expected.
I told you this would be 3 weeks. I'm now committing to 2 weeks. We're delivering on our commitments.
The rush to help comes as applications for unemployment benefits skyrocketed to a record-breaking 6.6 million last week, the most ever on record, and double the 3.3 million claims filed just the week before. Among those applying, Juanita Flores and her fiancé Gary Haldane, who say their already tight circumstances are just getting worse.
We were already living paycheck to paycheck, so it just kept snowballing.
While financial aid is on the way, major companies are furloughing their workers. At Disney, all employees whose jobs aren't necessary at this time. At Caesars in Las Vegas, 90% of its workforce. And for small businesses, grant applications are supposed to start today, but banks say they may not be ready and need further federal guidance on how to administer the program. Pierce Fleming, who owns this North Charleston brewery, needs the cash to keep paying his workers.
Anything that can be done to stop time on that and defer allows us more options relative to keeping people employed.
All this pain is swamping state unemployment offices coast to coast. Claims in California shot up 370%. In New York, where centers typically get 50,000 calls a week, they got 8.3 million last week alone. Centers in Texas received 1.7 million calls in a single day. In Colorado, the Labor Department is doubling its staff to keep up.
Are building the plane as we're flying it, I think, and doing the best we can.
And for college seniors preparing to graduate, looking for that first job is bleak.
Am I going to be hired anywhere? I don't know what my future looks like.
As for that small business relief package, we're getting reports that it has been very chaotic. Major banks say they just got federal guidance last night, 31 pages of it. The biggest bank in the country says they may not be ready to start processing those loans starting today. Also later this morning, we are getting that March jobs report, and it's expected to show yet another bleak outlook for the economy and likely just the beginning of the economic damage wreaked by coronavirus.
Wow.
Hoda?
All right, Joe, people need that money and they need it now. Thank you. Savannah, over to you.
Yeah, an update now, Hoda, on a story we've been following all week long. The Navy has dismissed the captain of the USS Roosevelt from his command after he sounded the alarm about a coronavirus outbreak on board his ship. Navy officials explained the dismissal, saying Captain Brett Crozier created unnecessary panic by sending a letter to a broad array of people, that's a quote, rather than the chain of command. They say he demonstrated extremely poor judgment. But Crozier will keep his rank, and he remains in the Navy. 93 crew members on the aircraft carrier tested positive for the virus, Hoda.
Meantime, those 2 cruise ships carrying sick passengers, well, they've finally been allowed to dock in Fort Lauderdale, Florida. But the weeks-long saga for many who are still on board this morning is far from over. NBC's Carrie Sanders is following that story for us. Hey, Carrie, what's the latest out there?
Well, good morning. The Zaandam and the Rotterdam, those two Holland-American ships over there, finally in port. On board this morning, 2,000 passengers and crew, 76 that the cruise line says are exhibiting symptoms consistent with coronavirus, and 10 others who this morning are fighting for their lives in the intensive care unit at a local hospital. Dockside Port Everglades, a high-risk transport Thursday of the most critically ill cruise ship passengers, some with worsening conditions, including pneumonia. Ambulance after ambulance, quietly rushing at least 10 COVID-19 patients to the intensive care unit at Broward's biggest hospital. As we've seen every day, coronavirus is a delicate challenge. Even moving passengers' luggage, a potential hazard because the virus can live on surfaces for days. The Zaandam and the Rotterdam had been scheduled to pull into port early Thursday, but the arrivals were delayed for hours as lawyers from Holland America and Broward County haggled over fine details of potential liabilities and required a 14-day self-quarantine for all passengers. Among those who watched the ships come in, Leanne Plisky, her aunt on board, but coming home alone. Her aunt's 75-year-old husband among the 4 dead.
Of course I'm sad, but relieved that finally has some kind of conclusion and that these poor people can go home.
Late Thursday, some passengers passed health checks, and with cleared to debark cards, masks and gloves, they took private, sanitized cars home.
What does it say?
Welcome home.
Doris and Cliff Colber.
We're home. We're in our living room, which feels fantastic.
But passengers worried about those who shared this 27-day odyssey of being denied entry in port after port. What's going through your mind beyond yourself?
Obviously, we hope that the sick are tended to and get better quickly.
Still on board.
Back to the States.
Almost to New Jersey.
300 Americans like Wendy and Rick DePino, who will head home today to another coronavirus hotspot.
I've already been warned by many friends in New Jersey that things have really changed and in some ways are unrecognizable.
Holland America says disembarkation is expected to be completed by Friday evening.
My goal is to wake up in our own bed Sunday morning.
About 900 of the passengers on board are foreign nationals. Today, they will get on sanitized buses, go to the airport where there are waiting charter flights to fly them to their home countries. Meantime, we've told you about Jennifer Allen's father, who was among those who was desperately ill on board, had developed pneumonia. This morning, we understand he is one of those in the intensive care unit getting the important care that you can only get in a hospital. Guys?
Yeah, that is good to hear, Carrie. Thank you so much. All right, what do you say we switch gears now and let's check in, Savannah, with Mr. Roker sitting at his house. Hey, Al.
Morning, Al.
Hey guys, good to see you. We made it to Friday, thankfully. And here in the Northeast, we've got this pesky storm that's offshore. It will not go away. We're looking at more rain, interior sections of New York and New England. But the good news is it'll be out of here by later today. All eyes now down on Texas, where we're looking at damaging winds, hail, a tornado risk that's fairly low, but still can't rule it out. Today, that strong cold front will move east. Severe storms developing in central Texas, and then continues to push on through Saturday and Sunday. And then the good news is we finally get rid of that. But we are looking for anywhere from 2 to 3 inches of rain through south and central Texas, and there could be some flash flooding.